Thank you very much, René, for the introduction. So as we've seen quite a lot this morning, coronary angiography using MR has shown very great potential in imaging the coronary arteries without radiation exposure or the need for intravenous contrast agent. However, free breathing CMRA still has a lot of major technical challenges, which currently limit its use in cardiac disease management. The coronary arteries are located very close to the myocardium, therefore we've got very strong cardiac and respiratory motion. We're trying to scan very small vessels, and therefore the need for high isotropic resolution is needed, and particularly sub-millimeter resolution, which results in very long acquisition time. So the goal of the project I'm going to show you today is to enable whole heart free breathing, non-rigid motion corrected sub-millimeter isotropic CMRA in a fast scan time and with high image quality. And we will start to demonstrate this feasibility in patients with suspected coronary artery disease. You've seen this framework quite a lot today, so this is the sequence we've developed a couple of years ago in King's College. It's an ECG-triggered acquisition where we include here T2 prep and FAT-SAT pulses in order to improve the contrast of the coronary arteries and suppress the signal coming from the fat. Here again, we've got the 2D iNavs to allow for 100% scan efficiency and predictable scan time, as well as translation correction of the heart in every direction. Now here we're talking about sub-millimeter isotropic resolution, so we need to accelerate this acquisition. So we use, and we've implemented this sampling. It's a variable density Cartesian sampling with spiral ordering. So at the end of this acquisition, we have a motion, translation motion corrected K-space and highly accelerated. Now when we talk about high acceleration, we need a robust reconstruction scheme. This is what I'm going to show you today with this non-rigid motion-compensated PROST reconstruction, where we first use the 2D iNav to extract a respiratory signal. And this signal is used to bin the data set. Here we use a binning of 5 respiratory phases that are then reconstructed to extract quite accurate non-rigid motion fields, 3D motion fields. And then we use those motion fields inside a motion-compensated reconstruction. So here, the main contribution here, we put those motion fields inside this data fidelity. This is the U variable that you see there. Now, with high acceleration, we have an acceleration factor of 5. We need to work a little bit more on the reconstruction. And we've developed and showed this PROST reconstruction last year, where we use PROST to regularize the reconstruction. PROST basically going to push the SNR of the images and improve the sharpness by looking for small patches in the image. We try to exploit the fact that we've got a lot of redundancies on a patch scale. So this effectively works as a denoising, and this denoised image is used to kind of regularize the motion-compensated process. We validated this framework in 10 healthy subjects and 8 patients with suspected coronary artery disease. We've implemented everything on our 1.5 Siemens scanner, and we have a sub-millimeter resolution here. We went for an acceleration factor of 5 to reach sub-10 minutes acquisition. So this is a predictable scan time, 100% scan efficiency. So you push the button and you know exactly when the scan is going to finish. We performed very conventional vessel length and vessel sharpness analysis, as well as image quality assessment. And for the patient, we compared with an additional CT contrast image. Here I'm showing you 3 healthy subjects, so whole heart sub-millimeter, and we see that the sub-millimeter resolution really improves the visualization of the coronary arteries and the fine structures, such as the distal coronary segment, as you see here. And actually even smaller branches, as you see here with the acute marginal branches coming off from the RCA, which are usually very small in caliber. So very fast acquisition time here for the 3 subjects of about 6 minutes predictable scan time. Now comparing with more conventional reconstruction technique, on the top we have translation motion correction only, where we see that yes, we can get high image quality and with great visualization of the coronary arteries. However, now, if we deal with proper non-rigid motions, we see that we have a better visualization, particularly of the distal segments of the coronary arteries. However, here at the cost of noisy images. So now, with the proposed framework, so non-rigid motion field and the PROST regularization, not only we have an improved sharpness and SNR, but we can also have a very nice visualization of the entire branches of both RC and LAD. This, of course, reflects on the quality metrics, where we see that non-rigid PROST here shown with the white box always improve compared to the other previous technique in terms of vessel sharpness, vessel length, as well as image quality scoring as performed by 2 of our cardiologists. Now, what about patients? Same observation. I'm showing you here 3 patients. On the top, translation correction only. On the bottom, non-rigid PROST reconstruction. And we see again an improved visualization of both RCA and LAD in a scan time here of less than 10 minutes predictable. Now, comparing with contrast-enhanced CT, we see that whole heart sub-millimeter isotropic CMRA shows excellent agreement with CTCA using this proposed framework, non-rigid PROST reconstruction at sub-millimeter isotropic resolution. Therefore, we reduce the gap between the 2 modalities. Of course, CMRA having the advantage to be a radiation-free modality compared to CT. Now, the isotropic nature of this acquisition and this framework allows us to reformat the 3D volume along any directions. And particularly, we can also follow very small coronary arteries like the first diagonal that you see here on the right with excellent visual agreement with CTCA. So I'm not lying by saying that we have pretty consistent image quality within the 8 patients. Here I'm showing you 3 additional subjects, great visualization and very good agreement with CTCA. So we have here an acquisition time of about 8 minutes for the 3 patients. A predictable scan time, free breathing as well. Now, what about patients with coronary artery disease? I'm showing you here a 54-male patient presenting with severe disease in the mid-segment of the circumflex artery, where we see a partially calcified plaque estimated between 70 and 90%. That results as well in a luminal narrowing on both CT and CMRA. So on this same patient as well, we saw a mild calcified plaque within the proximal RCA, visible here again on both modalities. So in conclusion, I've been showing you a novel non-rigid framework using PROST regularization, which enables isotropic sub-millimeter whole heart CMRA in less than 10 minutes predictable. So we have the 4 following ingredients. It's a non-rigid motion-corrected framework. We accept all data sets. It's 100% scan efficiency. We don't do any rejection. We can go to high acceleration factor for a fast scan time and high-quality CMRA reconstruction using PROST. Now we have one goal in mind, integrating this framework into clinical examination, which will enable rapid and comprehensive imaging of the coronary arteries. I thank you very much, and if there is any interest in this sequence, please come forward.